Assalamualaikum and good day to everyone. I am FARRAH Athiqah and in this video I will discuss about the study under the title of Proton Therapy versus VMAT for prostate cancer, a treatment planning study. As to your knowledge, 1 in 6 men will be diagnosed with prostate cancer and 1 in 36 men will die from prostate cancer. To begin with the introductions, prostate cancer is a common cancer among men and the second leading causes of mortality. Approximately 15% of patients with prostate cancer are diagnosed with high-risk disease. Patients who have high lesion grade, high tumor stage, and elevated PSA is classified to have high-risk disease. Generally, patients with high-risk prostate cancer disease have poor prognosis. VMAT and proton therapy are two most common treatments of choice for prostate cancer. VMAT has become a popular delivery option over IMRT since it only requires a smaller number of monitor units and shorter delivery time while providing conformal dose distribution. The purpose of this study is to compare the dosimetric quality of the VMAT with proton therapy for high-risk prostate cancer. In this study, 12 high-risk prostate cancer patients who was previously treated with uniform scanning proton therapy is included in this study. The dosimetric evaluation was performed by comparing the physical dose volume parameters which were obtained from the VMAT and proton plans. The comparison in treatment planning. VMAT uses double arc technique which has counterclockwise direction and clockwise direction, while for proton therapy, it uses two 180-degree parallel opposite lateral fields. For both techniques, a total dose of 79.2 Gray was prescribed to the PTB with a daily dose of 1.8 Gray. Organ areas at VMAT was optimized by a progressive resolution optimizer to minimize the dose to the organ areas, while for the proton therapy, the organ areas was contoured. In terms of technique, the difference between VMAT and proton therapy, VMAT technique delivers modulated photon beam with simultaneous adjustment of the multi-leaf collimator, field aperture, dose rate, and gantry rotation speed, while for proton therapy, the proton beam is scanned laterally with a constant frequency to deliver a uniform proton dose for a near rectangular scanning area, and the majority of the proton dose can be deposited in a region called the spread out bragg peak. In this slide, the image shows the difference between the technique used for VMAT and proton therapy. VMAT uses double arc technique while proton therapy uses two 180-degree parallel opposed. In this study shows that the average difference in the PTV doses between VMAT and proton pens was within 61%. The proton pens produce a lower mean doses to the rectum, active 0.2 Gray versus 40 Gray for the VMAT, and bladder 15.8 Gray versus 30.1 Gray. However, VMAT has shown to be lower at the mean dose for the femoral head, which is set to 28.3 Gray versus 90.3 Gray. In the conclusion, in terms of dosimetric quality for high-risk disease, proton therapy is feasible for treating high-risk prostate cancer involving the seminal vesicles. Proton pens produce favorable results for the PTB. For the same target coverage, proton pens always produce lower values for sparing the rectum and bladder in the low and medium dose regions, but it results a higher femoral head dose. VMAT technique was superior in sparing the femoral heads and better at reducing a bladder dose in the high dose region. Next, for the weakness and strength in this study. For the weakness, a small sample size was used in the study which only includes 12 patients. Next, proton therapy and VMAT planning cannot be acquired from the same institution, and dosimetric comparison only focus on PTB. And for the strength, both the VMAT and proton pens were normalized with the same PTB coverage so that 95% of the PTB volume received of the prescription dose. And lastly, this study is from Rana et al. In 2014. Thank you.